Coming up, we'll be on location at Avatar Dental Care in Leesburg, Virginia, discussing the benefits of sedation dentistry and how it can help you overcome the fear and anxiety of going to a dentist with one of this region's top dentists, Dr. Talib Ali. He is a member of the Academy of General Dentistry, the world-renowned Las Vegas Institute for Advanced Restorative Dentistry, and is a fast braces provider and is widely recognized as one of this region's leading dentists. Welcome, Dr. Ali. It's a pleasure having you on our program.
Thank you. Thank you for having me.
It's your first time, in fact, on the Top Doctors Medical Interviews. We've got several patients that are going to be joining us a bit later, but I wanted to begin by asking you about sedation dentistry and the importance of it and how it can help so many folks, because we all know that one of the largest fears that most of us have is going to a dentist, unfortunately.
Yeah.
And we dread it, we fear it, we get all sorts of no sleep the night before and high anxiety, all that bad stuff, and yet we have to go to a dentist. We need to have the treatments, we need to keep our smiles and mouth healthy. So can you please tell us what sedation dentistry is and how it can help folks overcome their fear of going to a dentist?
Sedation dentistry is a kind of dentistry where we use medication to relax the patient. Sometimes they call it sleep dentistry. But what it does is it helps people who have a lot of fear and anxiety, who never wanted to go to the dentist, and they got all their treatment done in one day, and good thing they don't have to remember that next day. Everything getting done in one time, and that's it. So here we use just medication, a pill. And those patients they found to be very comfortable. They take that at night, and when they come to our office, we crush a little bit under the tongue, and they go to sleep when we get everything done.
That's it?
That's it.
We don't even feel anything?
Just pill, you don't feel anything, you don't remember anything next day.
And what dental procedures are best performed on patients, would you say, that are under sedation?
Usually all extensive procedure which take longer time, like full mouth reconstruction or a lot of extraction to be done, but even root canal, as you have heard before. If patient they choose they want to be relaxed, everybody is, we give that to them.
Oh, okay. That's certainly interesting. And what would you say are some of additional benefits of sedation dentistry? Are there others beyond what we've talked about thus far?
Additional benefit is that patient, they become relaxed. They don't remember what happened during the procedure and post-operative pain, or they don't feel pain as usually if you do the procedure with no sedation. So when you do sedation, next day they don't have to take heavy drugs like Percocet, Vicodin. Sometimes I had a patient where they didn't have to take anything.
That's great.
Yeah.
They were everything was done, and they didn't have to worry about popping any Valium or Percocets or anything.
That's right.
Now, who would you say is a good candidate for sedation dentistry?
Usually patients who have a lot of fear or anxiety, those are the best patients for sedation, but also we give for anybody who have extensive procedure, because even if you don't have fear, when the procedure is long, it can take a toll on you. So we offer to anybody who wanted that, but mostly for patients who have fear for the dentistry.
And can a patient go back to work the same day after having a treatment under sedation, or what do you recommend?
No, normally they cannot go back to work because the medication we use, although the patient, they may communicate well, but there is an effect of forgetting everything happened to that day. It's good when they are with us, but it's not good when they go outside.
Yes.
So we don't want them to go to work for that reason.
And they should bring somebody with them, I would think, that can help drive them home, right?
Usually we take them to their transportation, we make sure they're seated in the car, and then they have somebody to take care of them at home.
Okay. And then they're good to go the next day?
Good to go.
Okay. And are there any age restrictions for patients who could be sedated, or is there a cutoff there?
Normally there is no age limitation. So for younger one, normally we can use like a laughing gas, which is not a pill, just laughing gas, and it works very good. For adult one, we can use just those pills, and it works very good. So we can serve them all.
We're now going to meet some patients of Dr. Ali and Avatar Dental Care.
I had several teeth that were needing extractions, and I had some that were loose. So I came in to see what type of solution Dr. Ali could give me for that problem.
So what happened then when you got here and met Dr. Ali?
I am a very nervous patient. I have been for several years. One thing is I'm afraid of needles, as well as coming to the dental office. So it has taken a lot for me to come into the office. But coming here, Dr. Ali explained to me the procedure that he would use as far as sedation, and there were no needles involved, which was wonderful. The process went very well. I'm very proud of the work he's done, and I'm very proud of how the procedure went. At this time, I have no fear of coming to the dentist, and I am very happy with how this has turned out. It has been a wonderful experience.
For all the folks out there watching, what would you tell them about your experience with the staff here as well as Dr. Ali?
The staff is wonderful. They made me feel very comfortable. They helped me with my anxiety as far as coming to the dentist, and I would suggest that if you want a beautiful smile, you want some very good care, and you want a good experience with the dental treatment, right here is the place to come.
Well, on that note, we'd like to thank you for joining us, sharing your experience, and being a guest on our program.
Thank you very much for having me, Rocco.
Thank you. Welcome, Deborah. It's great having you on.
I'm delighted to be here and to speak on behalf of Dr. Ali.
Well, I wanted to begin by asking you if you can please tell us all what brought you to Avatar Dental Care and Dr. Ali.
Yeah, well, I had relocated recently to Virginia, and my in-laws, who are in their 80s, had been coming to Dr. Ali, and he was so gentle with them. And I thought, well, I'm going to try Dr. Ali. And I had previously been in Maryland with a dentist for over 25 years, and I thought, how am I ever going to find someone that I'm comfortable with? The moment I met Dr. Ali, I knew it was right, and he was so gentle. When I got Novocaine injections, I did not even feel it. I said, have you started yet? And he said, I'm done. And so, I mean, his talent and his kindness, I'm delighted I found him. It was really a blessing.
Yes, indeed. And what are some of the treatments that you've had done over the time?
Well, I have silver fillings. I had silver fillings in many of my teeth since my childhood. I guess from having had a sweet tooth, which I've never outgrown. But they started to basically break down, and they were cracking, so I had to have them replaced. And I was having headaches, and we couldn't figure out why. And it turns out it was because of the fillings. It was just causing associated problems.
Oh boy, so then you came in here and
I
had
did.
all that taken care of.
I did, and I had crowns to replace the fillings, and there isn't a silver filling left in my mouth. My teeth look brand new.
They're all gone. The silver fillings
yeah,
are
the
gone.
silver filling.
You've got a beautiful new smile.
Yeah, it was the molars, but yes, I feel like confident I can bite on a carrot now.
That's great.
Or a chocolate chip cookie.
There you go. Nothing wrong with dabbling a little bit in the chocolate chip cookies. And for the folks out there watching, what would you tell them about your experience with the staff here as well?
Oh, they've been gracious and very easy to work with. They made me feel welcomed. I felt very confident in what they were doing, and I just have a very, very nice feeling that they gave to me, and I don't think it gets better than that, really.
That's wonderful.
So, well, I just wanted to share more about my experience with Dr. Ali, in that he exercises kindness that I've not experienced before from a dental professional, and nothing seems to faze him. I have never seen him without a big smile, and he's cheerful, and I was never afraid. He explained every aspect of the process as he was doing it, and said that he can stop if I feel any discomfort and remedy that. But I never had to ask him to stop, because I've not ever felt discomfort. And he even called me at home after I had a procedure that he wanted to make sure that I was doing well. And I would follow him anywhere on the planet. There's never been a dentist like this in my life. And given the amount of dental work that I had done recently, I'm so glad that I found him.
Welcome, Carl. It's a pleasure having you on our program as well.
Okay, nice to be here.
Now, I understand you're a trainer for the Washington Redskins football team.
Yes, sir. I train quite a few of them. I also own my own gym, and I'm getting ready to open my new gym any day now in Lansdowne called R&R Fitness. So I own 2 right here on Market Street in Leesburg and 1 in Ashburn.
That's wonderful. We can certainly all relate to the Redskins, being fans like many of us.
Yes, we can.
Now, I wanted to begin by asking you, Carl, if you can please tell me what brought you to Dr. Ali. What dental problem or problems were you experiencing?
I had a right tooth, and I think one day, maybe about a year ago, I ate something and a little piece of my tooth came off. You know, and it wasn't really bothering me. You know what I mean? As a man, I sat there and I bared the little pain that was causing, you know what I mean? But I started noticing a little discoloration in that particular tooth. So, you know, I was praying one day and I met the brother, Dr. Ali, and came down to my gym, passed out some flyers and, you know, told me come in and get a free cleaning. And, you know, I came and, you know, and he took such good pride in cleaning my teeth, and he recognized that I had an issue which involved a root canal. Mind you, I was in Germany as a child, and I had a root canal done. Such a horrific pain that it traumatized me for life. I was never gonna let a dentist do nothing to my teeth again. Previously, I just had them pulled. You know what I mean? But this particular tooth, he took his time and he explained to me that if I got this particular tooth pulled, that it was possible my jaw could drop. So it was a very important tooth that I needed. So he told me he could save my tooth. I didn't think he could be saved. He told me he could. So, and then the following week I brought my kids here, and my wife. And my son, he had, one son didn't have no cavities, but my youngest boy, he had 2 cavities. And prior to that, the dentist had told my son about a crown, you know, but I needed a second opinion because I didn't want him to go through the pain I went through. I brought him here to the doctor, and Doc took care of his, and he didn't even cry. That's when I knew he was good, because I seen the work he did, and I knew it was painful, but my 5-year-old didn't cry, so it gave me courage. So the next weekend, I scheduled mine around my Redskins schedule. It was actually during the bye week.
Okay.
Because I have to go to the games on Sunday. And I had to have the procedure done Saturday after all my work had been completed. And he put something under my tongue that tastes like lemonade. It tastes like lemonade. And then at that point, all I remember was a certain peace and tranquility that took over. My wife was there. She videotaped the whole thing. And after seeing this certain procedure done, there was no way possible I could have been awake to have that procedure. If you've never seen a root canal done, it's serious. It's some little needles that got to go up in the top of your gum. The first shot I took with him, he used a very unique way of giving me a shot. It was I would say it looks like a U-shaped instrument, and it vibrates. And he placed it upon my gum. And when he gave me the first shot of Novocaine, I did not feel it at all. From that point, he worked it. I woke up and had a great meal. I couldn't even tell my tooth had been touched. But then when I went and looked in the mirror, I seen that I had a new tooth.
Yes.
So it made me feel comfortable with the work he had done. Now I have no sensations of hot and cold.
Yeah.
My crown looks beautiful. Even when he put my crown on, he re-cleaned my teeth.
Yes.
You know, which that care that he took, it made me now find myself brushing my teeth 3 times a day. My teeth ain't never looked this good. And I'm 37, 38 years old.
Yeah.
My teeth ain't never looked this good. You know, but now I take a certain pride in my teeth.
Yes.
Because of the pride he took in my teeth. Now, had he not did that, I'd probably still be running around with a bum tooth.
Yes.
You know, now I smile a lot more now.
Yes.
I find myself, you know, proud of my smile once again. And like I said, there was a certain quality of care. His quality of care is excellent. So I can't, as a client of his, whatever dental procedure I ever have done, he'll always be the man.
Welcome, Megan. It's wonderful having you on our program as well.
Thank you.
Now, I understand in your case, like so many folks and the other patients as well that we've had on thus far, a lot of anxiety coming to a dentist, but yet you wanted a new smile in your particular case. Is that correct?
Yes, it is.
So what happened then when you got here and met Dr. Ali?
I got here and my whole, two of my front teeth were chipped and decayed, and I would not smile. I would not, it was horrible. I was 25 at the time, and my confidence was shot. So I came here and I didn't think that I would have the money to, pay for it, and I really didn't. But he wanted to fix my smile, and he gave me a great deal and got a new smile.
Oh, you got a beautiful smile.
Yes.
So it's really affecting your life like it does with so many other folks when you just didn't have the confidence, you had the issues going on with your teeth and thus affecting your smile, and then you came here, he worked with you,
Yeah.
customized a treatment plan, worked with you financially as well to make it all happen, and now you've got that beaming smile.
Yeah.
I take it you obviously feel much better again, you have your
Oh,
confidence.
yes, I definitely have my confidence back, and I smile now showing my teeth. So,
There you go.
brag about them.
Can you please tell us how long the process took to go from when you came to the smile you have now?
Just 2 visits, and it was done. My permanent crowns were in.
That's it.
Yeah.
That's wonderful.
Yeah.
And before I let you go, Megan, for the folks out there watching, what would you like to leave them with?
Dr. Ali and his staff are simply amazing. They treat you like family.
Well, that says it all right there.
Yeah.
And on that note, we'd like to thank you, Megan, for joining us and being a guest as well.
Thank you.
Welcome, Fern. It's nice having you on our program.
Thank you.
Now, I wanted to begin by asking you, what brought you to Dr. Ali?
Well, my parents had been going to Dr. Ali for a number of years, and I want to say that they are in their late 80s. And my dad, at the age of 87, needed root canal. And they raved about the fact that they loved the office, loved the way they were treated, and there was really no pain involved. And I couldn't believe it. I had the opportunity and knew that I had something going on. And I came to Dr. Ali, and I have no problem with shots. So that when I asked Dr. Ali about the filling, he said no problem. He numbed the gum, and he has a new device called a dental vibe that I had not seen before. Works great. That's a good way to put it. And while he is giving you the shot, you don't feel a thing. And within minutes, you're numb, and he starts on his procedure.
And you basically have a beautiful smile that he has done for you.
Yes, he's created for me,
Yes.
Absolutely. Over the years, as a sweet eater, many years, I have had small fillings in my front teeth. The problem is that your real teeth and the fillings don't age at the same rate, and there was a little bit of spottiness. And I work a lot, I'm a motivational speaker, and I was a little bit self-conscious of my smile. And I had mentioned it, here I was getting a filling, or actually a crown, but Dr. Ali said, oh, I can give you a whole new smile. And when I saw the befores and afters, I wanted to be an after.
Yeah, well, you are an after now.
Thank you, thank you.
And that little dental vibe device
Yes.
that he utilized while you were here with him,
Yes.
I understand it worked in such a manner that it really made the whole process very pain-free and comfortable for you.
Excellent. Yes, absolutely. I think there are a certain amount of people that don't want the sedation and say, I've had a needle in the past, it's okay. You won't even feel it. And he is as pain-free as it can be.
Yes.
And in addition, I'd like to say that he has television, and you can watch any channel you want, and it really takes your mind off what's being done.
Yes.
And for me, it was not a big deal. Also, it was done in 2 visits.
All this,
All this,
that new smile.
absolutely, 2 visits. One to drill and create the impression, and the second to install. And it's been fantastic, the results.
And lastly, before I let you go, Fern, for all the folks out there watching, what would you tell them about your experience with the staff here as well as Dr. Ali?
Well, first of all, when you call, you're treated like royalty, and you feel like when she makes your appointment, it's easy. When you are here, it's immaculate, it's organized and friendly. And the respect that not only Dr. Ali, but his staff gives you. They make you comfortable at all phases, from the time you step in the door till the time you walk out with a new attitude.
Well, on that note, we'd like to thank you, Fern, for joining us, sharing your experience, and being a guest on our program.
Thanks an awful lot.
It was our pleasure. We're now back with Dr. Ali. I must say, Doctor, the patients love you. You help them overcome major fears, anxiety, to the point where you heard Carl. I mean, he was a man who was popping Valium the night before, already had the Percocets ready to go after he left your office, didn't even need them.
Yes.
Didn't even need them. And you are helping them. They've gotten their confidence back. Their smile is back. Mouth is healthy again. All because of you, Dr. Ali, and Sedation Dentistry, and how it helped them overcome that fear.
Yes, normally our patients, they are our family. So normally I take a very great pride with our patient, and we follow up with them. We call them after the procedure, we call them at home, and also we give them my cell phone number where they can reach me in 24 hours. So that way we provide a 24-hour service. Anytime they can reach us.
You don't hear that from any other dentist, I can tell you. Not to mention, Deborah was telling me off camera, who we just interviewed a few moments ago, one of the patients, that you actually went to the levels of even taking her in-laws, her elderly in-laws, to the nursing home late at night.
Yes, we do.
These are the things you do that are way, way above and beyond what you would think a dentist would do for his patients. You really are family with your patients. It shows.
Thank you. Yeah, normally that's how we do. We treat our patient as our family. Some of them have went to their funerals, and I mean, it's just, I'm very connected with our patient.
Yes,
We don't just deal with them as a patient, but they become part of our family.
Yes, and you heard Deborah. She said she'd follow you around the world.
She's my champion.
Wherever you are, that's how much how she feels about you.
She is my champion. She's a very good patient.
Yes, indeed. Now, how long would you say, Dr. Ali, does the sedation typically last? I know it varies based on how much you sedated each patient, based on his or her particular needs and the treatments they're having done, but in general.
Generally, it can last maybe 3-4 hours, but after effect, which is for patient to forget what happened, that can take maybe more hours, 7-8 hours.
Okay.
So the sedation itself, it can take just 2 to 3 hours or 4 hours. It depends how many medication we give it to the patient. But after the sedation, the condition of not remember what happened to that day, that is the thing we don't want the patient to go to work or anything else.
Yes, yes. And how safe is sedation dentistry?
It's very, very safe. Normally, we take a good screening of our patient, and we haven't encountered any problem.
That's great to
Any
know.
problem, yep.
Well, on that note, I'd like to thank you, Dr. Ali, for joining us, enlightening us on the importance and the benefits of sedation dentistry and how it can help so many of us overcome the fear of coming to a dentist. And we really thank you for coming on and being a guest again in our program.
Thank you very much for having me.
It was our pleasure.